The time I was at Whitehall through 10th grade, one of the main things I remember is dissecting a frog in the biology class. I was an Air Force reservist, but initiated my healthcare career prior to going to basic training. I served 34 total. 26 was as a reservist. My initial 4 was in avionics because of that initial recruitment that I did, electronics specific work at Newark Air Force Station. And then I realized I wanted to be closer to home to be at Rickenbacker, and a new recruiter told me, oh, you can either test hearing in the clinic or fly as a med tech. A reserve recruiter came to my class at Eastland Vocational with the intent of being a reservist at Newark Air Force Station, but it was a delayed entry. So I needed work for a couple of months prior to going to basic training. And one of the upperclassmen from Whitehall suggested I work at a nursing home, and she said, this is difficult work, but it's rewarding if you hang in there. And she was right. It was hard and intense and very gratifying. Monitoring your sleep makes a huge difference. So it does turn into help us help you. So it's a participatory type of care. Certainly more acknowledgement has happened with the pandemic, and yet I don't feel that everyone benefited from feeling cooped up. But then again, it's sitting with yourself and acknowledging, do I have true anxiety or social anxiety? And that's where I think our current patients may not fully become overcoming their social anxiety because they solely do telehealth. Patients who happen to also be caregivers have trouble disconnecting from the caregiver role. If you don't do better self-care, then you are not going to be a good caregiver. And until they address self, how can they help others?